Hi everybody, we're joined today by Amanda Anthony from Children's Links. Amanda coordinates across multiple centres as a paid coordinator, so we're going to hear how she manages that. Can you give us an introduction into your service, Amanda?
Yes, of course. So our contact centres are part of a wider organisation called Children's Links. We are a children's charity that was established in 1993. Our main focuses of the charity are to improve the life experiences of children, families, young people and their communities. And we do lots of things. We obviously have the contact centres, but we have community outreach services, we have employability support, family support, we have a toy library, play services, childcare. We've been working in the vaccination centres during the COVID outbreak, sector support, lots of things. From a contact point of view, we have 5 supported contact centres and 1 supervised centre. 4 of our supported centres opened in 2014 after the local centres closed due to lack of funding, and Lincoln followed later. We've opened our supervised centre in Lincoln earlier this year because there was a huge gap in provision. We operate out of local family centres. We're really very lucky that our local authority allows us to use them. They are purpose built for contact, so they're secure buildings, they've got nice rooms, very child friendly, etc. So that's great. And the local authority also offer us support if we need them.
Do you think this helps to make the contact service more sustainable?
Yes, absolutely. If not anything else, it shares the cost of such as the back office functions such as HR and accounts and payroll, etc. But it also provides us with a bank of staff. So whilst the contact centres have a paid member of staff at each centre and also volunteers, if we're short staffed because we haven't got volunteers, we've usually got somebody local that will step in just to help us out. But it also means we've got lots of different experiences. So for instance, I've worked within the children's centres, so I've got a good local knowledge of different services that are available that can support families. So obviously it means that we can signpost families within the contact centres also. But it also means that it makes us more child friendly. We can help settle that child. We've got more tools, if you like, to help work with that family and make contact successful.
Okay, so coordinating several centres, can you tell us a little bit more about that?
So I coordinate the centres remotely. So my role is to deal initially with the initial inquiries. So I've filled inquiries from the solicitors, from the families themselves, from CAFCAS, from social services. Obviously I send out the information packs, the referrals come in, I make contact with the relevant people, so the families and obviously any services that are involved if we think it's relevant, do the risk assessments, get them to the point where they're booked in for a pre-visit and they've got a start date booked in. And then I have a deputy at each centre. They then take on, so they carry out the pre-visits. They show the families around, they settle the families, they obviously deal with the day-to-day business at the physical centre. I'm on the end of a phone during the contact session, so I can actually help if there's an issue, but obviously they're all experienced members of staff to be able to deal with normal run-of-the-mill things, but I'm always on hand if there's something a little bit more unusual or a bit more extreme.
Okay, what do you think the pros and cons are in running multiple centres with one coordinator?
I think one of the massive pros is obviously a cost. So whilst we are paying a staff member at each centre, obviously it's at a slightly lower rate and it is literally just for that session, whereas obviously the coordinator role is quite involved away from the actual session, getting people set up, liaising in between contacts. Obviously there's usually the niggles between families, or something may have happened, and obviously I can deal with that, and the staff at the centre don't have to. Another pro is I can be that hard-faced person that deals with the issues. So if a family aren't adhering to our terms and conditions, I can be that person that rings and says, actually, no, you need to do this. And it doesn't interrupt or disrupt their relationship with the on-site staff. Equally, if they have an issue with the on-site staff, obviously I can deal with that as a complaint, as not an independent person, because obviously I'm not independent, but as the next level. Whereas if I was on site, obviously it would have to go further up the line to deal with. The cons obviously are I'm not there, so if something does go wrong, I'm at the end of the phone, but you know, sometimes it might be easy to deal with something face to face. So if there is an incident, then I can feel a little bit useless.
How do the individual centres manage without a coordinator on site when they're open?
They kind of have a coordinator on site, because the deputy is probably working to a coordinator level anyway. So whilst I'm there on the other end of the phone, you know, they're the ones that have built up the relationship with the families. They have access to the referral forms, the risk assessments. They're obviously familiar with all of the NACCC procedures and the training, etc. And they've all got experience, so they've either come through as volunteers and they've progressed into that role, or they've worked within a children's services environment, not necessarily social care, but we've got 2 nursery managers, so obviously they're dealing with managing staff, managing families. We've got a pastoral care worker, so they've got the tools to be able to deal with the families and to deal with run-of-the-mill issues, if you like.
Okay, this question comes in 2 parts. I understand you're a paid coordinator. What do you think the pros and cons of this are, and how does the service manage to have the revenue to pay your salary?
So I actually manage 3 services. So I manage the contact centres, but I also manage the tour library that we have in Lincoln City, and also our mobile play service. So obviously the cost of me is split between 3 services for starters. It also means that the cost of running the centres is split too. We pay for it through, obviously we get the CAFCAS grant, but we also do charge a set fee for up to 6 months of contact, so that helps. And we're quite good at kind of networking and popping into a local Rotary Club to give a presentation, and they quite often will donate a little bit of money, or our local co-op will have community champion money that we can apply into if we need to. So that's how the role's paid for, really. Obviously the con of that is if ever there isn't the funding, or we don't get the families. So obviously this year we haven't had the same level of families through because we can't have the numbers in, is that the service won't be able to run at a loss, unfortunately.
If others were thinking of replicating something like what you've talked about today, what would your top tips be?
This is a really difficult question, because actually I don't know. I kind of migrated into this role almost. Somebody left and it came my way. I think one of the top tips is networking is really essential. So if you can get out and about and meeting with other organisations, sometimes you can share facilities, for instance, or maybe join up with another contact centre to help with payroll, share information with regard to funding streams, things like that. So that would probably be my biggest tip, would be to network, to get to know other people, such as the coffee shop is invaluable, because obviously you hear how other centres are doing things. and also a range of volunteers with different experiences. So we're finding that we're getting a lot of interest to volunteer from nursery staff who perhaps have a bit of an interest in health and social care. So they've already got a really good background in working with families. So we can utilize their skills. It does mean that, especially through the pandemic, they've been used to dealing with families anyway. They haven't stopped working, so it hasn't been such a big deal for them to return into the contact centres.
That's been really helpful, Amanda, and I'm sure many contact centres can take your model, and that will help with the sustainability of other centres. If we get some questions coming for other centres, are you happy to respond to them if they need any further advice on the model that you're using?
Yes, absolutely. I'm more than happy for my mobile number or my email address to be passed on to help where we can.
Fantastic. Thank you for coming and sharing your ideas with us and in your service with us. Thank you.
Oh, thank you very much for inviting me.